I want to talk to you today about a part of the heart that a great many older adults never think about, but that genuinely matters in later life and is often misunderstood. Your heart valves, what they do, the problems that can develop with them as you age, the signs worth knowing, and why catching valve problems matters. Because most people think of heart trouble in terms of blocked arteries, blood pressure, or rhythm, and don't realize that the heart's valves can also develop problems, particularly with age, and that these valve problems are common in older adults, can affect how you feel and how your heart works, and are often treatable, sometimes very effectively, when recognized. So today, I want to explain what the heart valves do, what can go wrong with them as you age, the symptoms to be aware of, why they're often missed or attributed to aging, and when to see your doctor. And I'll keep this calm and practical, because while heart valve problems are a real and important part of heart health in later life, understanding them, recognizing the signs, and getting them checked lets you catch and address them, often very effectively, in partnership with your doctor. This is about understanding an underappreciated part of your heart and recognizing when to seek care. Let me start with what the heart valves do, because understanding it shows why valve problems matter. Your heart has 4 valves, which act like one-way doors between the chambers of the heart and the vessels leaving it, opening to let blood flow forward and closing to stop it flowing back, so that with each heartbeat, blood moves through the heart in the right direction. These valves are essential to the heart pumping efficiently. They ensure blood flows forward properly and doesn't leak backward. When a valve works well, it opens fully and closes tightly. Valve problems arise in 2 main ways. A valve can become narrowed and stiff, so it doesn't open fully and the heart has to work harder to push blood through the narrowed opening, called stenosis. Or a valve can fail to close properly, so blood leaks backward, called regurgitation, or a leaky valve, making the heart work harder to maintain forward flow. Either way, the heart has to work harder, and over time this can strain it. So the heart valves are one-way doors ensuring blood flows forward properly through the heart, and valve problems, a valve narrowing and stiffening so it won't open fully, or failing to close so blood leaks back, make the heart work harder and constrain it. So understanding the valves and how they can go wrong frames why valve problems matter. So valve problems make the heart work harder. Let me explain what can go wrong with the valves as you age, because age is a major factor. Valve problems become more common with age, for several reasons. The most common age-related valve problem is the gradual stiffening and narrowing of a valve, particularly the aortic valve, the main outflow valve, which can become narrowed and stiff over years, often from a wear and tear and calcium deposit process called aortic stenosis, which is genuinely common in older adults and important. Valves can also become leaky with age, failing to close properly, allowing backward flow. Valve problems can also result from past conditions, from the heart enlarging or being affected by other heart disease, or, less commonly now in many places, from past rheumatic fever. The key point is that age itself is a major factor, with valve stiffening and leaking becoming more common in later life. So heart valve problems are genuinely a condition of older age worth being aware of. So with age, valves commonly stiffen and narrow, especially the aortic valve in aortic stenosis, or become leaky, often from wear and tear and other heart changes, making valve problems a real and common part of heart health in older adults. So age-related valve stiffening and leaking are common in later life. So valve problems are genuinely an older age concern. Let me describe the symptoms of heart valve problems, because recognizing them is what gets them caught, and they're often missed. Heart valve problems may cause no symptoms for a long time, especially early, which is part of why they're missed. But as they progress and strain the heart, they can cause symptoms. And here's the crucial thing. The symptoms are very much like those of other heart problems and are easily attributed to aging. They include breathlessness, especially on exertion, as the heart struggles, like the exertional breathlessness I've discussed, fatigue and reduced ability to do activities, dizziness, lightheadedness, or even fainting, especially with exertion, which can be a particularly important sign with a narrowed aortic valve, chest discomfort or tightness, especially on exertion, palpitations, and, as valve problems lead toward heart failure, the swelling and breathlessness of heart failure I've discussed. So the symptoms of valve problems, breathlessness on exertion, fatigue, dizziness or fainting especially with exertion, chest discomfort, palpitations, and heart failure signs, overlap with other heart problems and are easily attributed to aging, which is exactly why valve problems are often missed. Importantly, dizziness or fainting on exertion is a notable sign worth heeding, as is exertional breathlessness or chest discomfort. So the symptoms overlap with other heart problems and are easily dismissed as aging, with exertional breathlessness, dizziness, fainting, and chest discomfort being notable. So recognizing the easily dismissed symptoms is key to catching valve problems. So the symptoms are real but easily attributed to aging. Let me mention how valve problems are often first detected because it points to the value of checkups. Often, a heart valve problem is first suspected not from symptoms, but when a doctor, listening to your heart with a stethoscope, hears a heart murmur, an extra sound caused by turbulent blood flow through an abnormal valve, which can prompt further assessment. This is one reason routine checkups and your doctor listening to your heart matter, as I've discussed about checkups, since a murmur can flag a valve problem before it causes obvious symptoms or while symptoms are being attributed to aging. So valve problems are often first detected when a doctor hears a heart murmur on examination, which is a reason regular checkups and heart examinations are valuable, and another reason to mention symptoms like exertional breathlessness, dizziness, or fainting to your doctor, who can listen to your heart and assess further. So a heart murmur heard on examination often first flags a valve problem, underlining the value of checkups and of mentioning symptoms. So examination and checkups often catch valve problems. So murmurs heard on checkup are a key route to detection. Let me explain why catching valve problems matters, because it's genuinely important and often very treatable. Catching heart valve problems matters because, untreated, a significant valve problem progressively strains the heart and can lead to heart failure, worsening symptoms, and serious risk. So it's important to identify and manage. But, more hopefully, valve problems are often very treatable, and this is the encouraging part. Depending on the valve problem and its severity, treatment ranges from monitoring mild problems over time to medications to manage symptoms and related conditions. 2. For significant valve problems, procedures to repair or replace the valve, which can be remarkably effective at relieving symptoms and improving how the heart works and how the person feels and lives. Importantly, the field of valve treatment has advanced, including less invasive procedures that have made valve treatment possible for many older adults who might not have been candidates for major surgery, so even significant valve problems in older adults can often be treated effectively. So catching valve problems matters because untreated they strain the heart toward heart failure, but they're often very treatable, from monitoring to medications to valve repair or replacement, including less invasive options for older adults, which can be remarkably effective, so recognizing and addressing them genuinely helps. So catching valve problems matters because they're serious, untreated, but often very treatable. So the treatability makes catching valve problems genuinely worthwhile. Let me be clear about when to see your doctor, because recognition leads to this treatable care. See your doctor if you have symptoms that could relate to a valve or other heart problem, breathlessness on exertion, fatigue and reduced activity, dizziness, lightheadedness, or fainting especially with exertion, chest discomfort or palpitations, rather than dismissing them as aging, since they can signal a valve problem or other heart condition worth identifying. Mention especially exertional dizziness or fainting, which is a notable sign. Keep up your regular checkups, where your doctor listening to your heart may detect a murmur. If a valve problem is suspected, the doctor will assess it, often with a scan of the heart that shows the valves working, an echocardiogram, which is the key test, to determine the valve problem and its severity and guide management, and seek urgent or emergency attention for severe symptoms, fainting, severe breathlessness, or chest pain, as I've discussed. So see your doctor about symptoms that could relate to a valve problem rather than dismissing them as aging. Keep up checkups where a murmur may be detected, and seek urgent care for severe symptoms, leading to assessment and the often very effective treatment. So see your doctor for the symptoms, keep up checkups, and seek urgent care for severe signs. So recognition and checkups lead to treatable care. Let me paint you a picture of how this plays out. Picture a man in his 70s who's become breathless on exertion, tired and occasionally dizzy, even nearly fainting once climbing stairs, but who attributes it all to getting older and being out of shape, not realizing these can be signs of a heart valve problem. In the unaware version, his aortic valve, narrowing with age, progressively strains his heart while he dismisses the symptoms until it advances toward heart failure, the missed valve problem having been allowed to progress. Now picture him understanding that these can be valve symptoms. He recognizes that exertional breathlessness, fatigue, and especially dizziness and near fainting on exertion are worth checking, not just aging. So he sees his doctor, who listens to his heart, hears a murmur, and arranges an echocardiogram that reveals significant aortic stenosis. With this caught, his doctor manages it and, as it's significant, arranges a valve procedure, including the less invasive options now available, which relieves his symptoms, takes the strain off his heart, and lets him feel and function far better. The same man, but recognizing his symptoms as possible valve problems rather than dismissing them, got a treatable condition caught and very effectively addressed. That contrast is exactly why understanding heart valves and recognizing their signs matters. So recognizing the valve symptoms got his condition caught and treated. And let me speak directly to those of you caring for or close to an older person, because valve problems are common, easily missed, and very treatable. Understand that heart valve problems, a valve stiffening and narrowing like the common aortic stenosis, or becoming leaky, are common in older adults, make the heart work harder, and can cause symptoms easily attributed to aging. You can help by understanding that breathlessness on exertion, fatigue, dizziness, lightheadedness, or fainting, especially with exertion, chest discomfort, and palpitations can be signs of a valve problem, and encouraging seeing the doctor for these rather than dismissing them as aging, with exertional dizziness or fainting especially notable. Encourage keeping up regular checkups, where the doctor listening to the heart may hear a murmur that flags a valve problem. Understand that valve problems are often very treatable, from monitoring to medications to valve repair or replacement, including less invasive options now available for older adults, so catching them is genuinely worthwhile and hopeful. And know that fainting, severe breathlessness, or chest pain needs urgent care. Helping a loved one recognize possible valve symptoms and get them checked can catch a common, treatable condition and lead to treatment that genuinely improves how they feel and live. So your help recognizing and acting on valve symptoms genuinely helps. Let me draw this all together. Your heart valves, the one-way doors ensuring blood flows forward properly through the heart, are an underappreciated but important part of heart health in later life. Valve problems, a valve narrowing and stiffening so it won't open fully, like the common age-related aortic stenosis, or failing to close so blood leaks back, make the heart work harder and constrain it, and become more common with age. The symptoms: breathlessness on exertion, fatigue, dizziness, lightheadedness, or fainting, especially with exertion, chest discomfort, and palpitations, and eventually heart failure signs, overlap with other heart problems and are easily attributed to aging, which is why valve problems are often missed, with exertional dizziness or fainting being especially notable. Valve problems are often first detected when a doctor hears a murmur on examination, underlining the value of checkups. Catching them matters because untreated they strain the heart toward heart failure, but they're often very treatable, from monitoring to medications to valve repair or replacement, including less invasive options for older adults, which can be remarkably effective. So see your doctor about symptoms that could relate to a valve problem rather than dismissing them as aging. Keep up checkups where a murmur may be detected, get assessed with an echocardiogram if suspected, and seek urgent care for severe symptoms. So here's what I'll leave you with. First, understand that your heart valves are one-way doors ensuring blood flows forward properly, and that valve problems, a valve stiffening and narrowing so it won't open fully, like the common aortic stenosis, or becoming leaky so blood leaks back, make the heart work harder and become more common with age, making them a real part of heart health in later life. Second, recognize the symptoms, which overlap with other heart problems and are easily attributed to aging: breathlessness on exertion, fatigue and reduced activity, dizziness, lightheadedness, or fainting, especially with exertion, chest discomfort, and palpitations, with exertional dizziness or fainting being especially notable. Third, see your doctor about these symptoms rather than dismissing them as aging, since they can signal a valve problem or other heart condition worth identifying. And keep up your regular checkups, where your doctor listening to your heart may hear a murmur that flags a valve problem. Fourth, understand that valve problems are often very treatable, from monitoring mild ones, to medications, to valve repair or replacement for significant ones, including the less invasive procedures now available that have made effective treatment possible for many older adults, so catching them is genuinely worthwhile and hopeful. And fifth, if a valve problem is suspected, your doctor will assess it, often with an echocardiogram that shows the valves working, and seek urgent or emergency care for severe symptoms like fainting, severe breathlessness, or chest pain. Heart valve problems are a common, underappreciated, but often very treatable part of heart health in later life, so understanding them and recognizing their signs, rather than dismissing them as aging, lets you catch and effectively address them, which is well worth doing. So take care of yourself, understand your heart valves, recognize the signs, keep up checkups, and get possible valve symptoms checked. And because diagnosing and treating heart valve problems require a doctor, please treat symptoms like exertional breathlessness, dizziness, or fainting as your reason to see your own physician, who can examine your heart, assess any valve problem, and provide the often very effective treatment, rather than dismissing them as aging, and seek urgent care for fainting, severe breathlessness, or chest pain.